an increase in collagen and increase in elastin, that it's upregulating many of the collagen and elastin building signals.
These data demonstrate that the intake increased bone mineral density in postmenopausal.
In effect, means the body was signaled to build more collagen. Hi, I'm Dr. Ajani, and today I'm going to tell you about the #1 supplement that I tell all of my patients to take. But the thing is, most people still don't take it and they don't know about it. And there's 3 main reasons people don't take it, and I'm going to show you today with science backed up by studies why people haven't caught up to this amazing anti-wrinkle supplement that I put all of my patients, and especially biostimulator and PRF patients, on.
We are going to look at actual science and published studies today. But first, what do real doctors practicing in real life say? Well,
I was invited to an ad board about 12 years ago. We were talking biostimulators, things like PRF, PRP was more common at that time, and things like Sculptra. And out of the 50 providers in the room, there was plastic surgeons, dermatologists, aesthetic physicians in the room. The question was raised to them, what do you put your patients on as an adjunct that boosts the results of biostimulators? Only 4 people in that room put up their hands and said collagen peptide.
So back then, that's 8%. 8% of practicing clinic aesthetic doctors were using it. It was tiny.
I was not doing this at that time 12 years ago. I went to talk to them after the Congress was over because it was a little taboo at the time. You're thought to be out there. Well, since then, the studies have piled in. Just this past April, I was at a big Congress. Out of the 12 people on stage, 9 put their patients on collagen peptides along with biostimulators and without, as a standalone to reduce wrinkles, help with nails, hair, and skin. Those are the things most aesthetic patients are concerned about.
That's 75%. That is a huge difference. 75% of practicing clinic aesthetic doctors use collagen peptides or recommend them to their patients. Clinical practice these days is as important, if not more important, than many of the studies that tend to be biased. These doctors answer directly to their patients and the happiness or lack of it with their outcomes.
So a huge turnaround. And the reason is the studies have piled on, but a lot of practitioners have not kept up with the data. And the reason is most practitioners are trained by Big Pharma. So if you ask your injector, your Botox provider, say, or the person providing med spa services where they were trained, about 100% of them will say a good portion of that came from within the industry. And there's no real money to be made in collagen powders. It's not like something that you can market like you can with a drug. And so people are behind on giving this out. So the 3 most common reasons why doctors don't put their patients on collagen peptides: #1, they say it can't be absorbed. #2, they say there's no way it can signal anything in the body. It can't be bioactive. And #3, they say, well, where does it go when it gets absorbed? Do you think it just goes to the skin? And I do have a video I'll put at the end that was a study that showed a reduction in wrinkles. But keep in mind, if you look at what you guys say in the comments below my collagen peptides and collagen powder videos, it's ubiquitous. People say it didn't help my skin, but it helped my hair and my joints. Others say it helped my joints and my skin. Others say it was hair and nails. So the first kickback is, hey, it can't be absorbed. But let's look at this study. So this study was in the Journal of Nutrients, and they gave subjects 35 grams of hydrolyzed collagen versus non-enzymatically hydrolyzed collagen, and they also used a placebo in the form of water. What they found is that the hydrolyzed collagen absorbed significantly better, so they actually ended up having an increase in serum levels of the amino acids, and these are the important ones: proline, glycine, and hydroxyproline, meaning that when you take it in the supplement form, indeed you had increased amino acids.
Let's look at the details of the study, and for those that don't like details, just go to the timeline below and skip ahead to the next point. But for those that want the deep dive, just keep watching. So here's an important study: enzymatic hydrolysis of a collagen hydrolysate, so hydrolyzed collagen, like what's in a collagen powder, enhances postprandial, so after eating,
absorption rate, a randomized controlled trial. We always like that. And of note, this is 2019, and it is in the Journal of Nutrients. So here we go. Collagen is characterized by its high content of glycine, proline, and hydroxyproline, and is found to exert beneficial effects on joint pain related to activity and osteoarthritis. However, to exert any beneficial effects, it is essential that collagen is optimally absorbed. And that, ladies and gentlemen, is what people say does not happen. Well, this study aimed to investigate the postprandial absorption. It was a randomized, blinded crossover study. But look here, blood samples were drawn before and up to 250 minutes following ingestion, and they found a significant increase in the plasma concentration of nearly all amino acids.
Remember, amino acids are what are used to build your collagen. Yes, the structure and support of your face, your glow, your lift, your defense to facial sag.
Of course, many of you like graphs. Here's the enzymatic hydrolyzed collagen, non-enzymatic hydrolyzed collagen, and of course placebo, which in this case was H2O or water. The purple, that represents the enzymatic hydrolyzed collagen. Looks like that's like a greenish color. That was the other type of hydrolyzed collagen. And here is the water. But look at the graphs and the amount of amino acid increase. And here's time. You can see it's very significant and very different than water. So it does absorb. Now, number 2, and we know signalers from biostimulators. So we put biostimulators in a face. What we're looking for is a decrease in matrix metalloproteinases, an increase in collagen, and increase in elastin. And increasingly, we know that it's upregulating many of the collagen and elastin building signalers. So a lot of this has to do with signaling in the body. But this is amazing because collagen peptides taken by mouth have been shown to be bioactive. Let's look at this. Bioactive peptides that were in the collagen they consumed ended up acting as signaling molecules. This, in effect, means the body was signaled to build more collagen based on the ingestion of these collagen peptides from the collagen powders. Since that means these collagen peptides act as signalers to tell your body to ramp up your collagen production, your main support of your skin and integrity of much of your body. Okay, here's a 2018 study in Nutrients here. Specific collagen peptides improve bone mineral, that's what they're looking at, bone mineral density, and bone markers in postmenopausal women, a randomized control study. Now that's an important one because postmenopausal estrogen goes down. They're looking at bone mineral density. And this is probably a big reason why many women especially find it helps with their joints. But let's look at what we can learn from this one.
What I like about this study is, look here, 131 women, that's a good size, were enrolled in this, here we go, randomized, placebo-controlled, double-blinded investigation. We love to hear that. Now, as well, the primary endpoint, the number one thing they're looking for, was the change in bone mineral density. And for those of you over the age of 50, you'll know femoral neck, that's around the area of your hip, and spine. So that's where we're measuring the bone density, the two key areas. But there's more. Look here. In addition to plasma levels of bone markers, amino terminal propeptide of type 1 collagen and another type 1 collagen were analyzed. So they looked beyond just the bone density here.
And here's the conclusion. These data demonstrate that the intake increased bone mineral density in postmenopausal women with the primary age-related reduction in bone mineral density. In addition, the collagen peptide supplementation was associated with a favorable shift in bone markers, indicating increased bone formation and reduced bone degradation.
So taking collagen signals your body, build more collagen, and that's a win.
Now, number 3, people say, well, when you ingest it, where can it possibly go? But check this out. A study published in Medical Research and Opinion found that when collagen was consumed and absorbed through the small intestine, it went to the cartilage. So it actually absorbed through the bowel through your body and found later directly in the cartilage.
Okay, let's look at this study. Collagen hydrolysate for the treatment of osteoarthritis, again, joints. A review of the literature. So this is a review article. I think this might be the most fascinating of all. Check this out. According to published, orally administered collagen hydrolysate, those collagen peptides, has been shown to be absorbed intestinally. So again, it's absorbed. And look at this, to accumulate in cartilage. That's the cause of many people's knee pain, of course, is the wearing out of the cartilage. Collagen hydrolysate injection stimulates a statistically significant increase in synthesis of extracellular matrix macromolecules by chondrocytes. Osteocytes produce bone, chondrocytes produce cartilage. I thought that was stunning. They go on to say these findings suggest mechanisms that might help patients affected by joint disorders such as osteoarthritis. They showed collagen hydrolysate to be safe and to provide improvement in some measures of pain and function. And here we have both men and women.
So you see, it gets absorbed. It acts as a bioactive signal to tell your body to ramp up collagen, and collagen was found in the cartilage. But one of the number one findings we have with giving collagen powder for skin is that people say, hey, yeah, my skin looks good, but my joints, I feel better. I'm more limber. And that's a win right there. And of course, hair and nails as well. Now, I did look at a study that showed a reduction in wrinkles. You're going to want to watch this video right here. I outline in detail that to keep your skin and body beautiful, healthy, and vibrant.